Maria. Thank you so much for the organization of this webinar and for allowing me the opportunity today to talk to you about a topic that I'm very passionate about, and that's infection prevention and control. I won't stay on the video this entire time. I won't force you in the afternoon right after you've taken lunch to look at my face this entire time, but just so that you know who's talking to you so that you can see me. I'm an infection prevention and control specialist. I've lived in Africa for 14 years, and I've worked in a lot of different contexts and in different situations. I am also working with WHO Afro in the Brazzaville office, the regional office. And if you have any IPC questions, feel free to ask me. I also like to have a very interactive session, so feel free to, as mentioned, to please type your questions in the chat, and I will do my best to answer them when we're finished. Can everyone see that okay?
Yeah, if you can put, yeah.
Yes.
Okay, perfect. So today we're going to talk about infection prevention and control, but specifically in maternity and OB-GYN considerations for low resource settings. So we're going to talk a lot about what we can do in terms of getting a little bit of background information on IPC, particularly as it relates to this current pandemic we are in. The second module I'm going to talk about are some of the IPC recommendations that we need for outpatient settings, particularly antenatal care. And then third, we're going to talk about IPC considerations that we need within specialized areas in the healthcare facility, most notably maternity wards, L&D, and then surgical theaters for those patients of ours who may need a C-section or have some form of obstetric emergency. So the first module, I don't want to spend too terribly much time on module 1 because it is very basic information. Again, the goal here is just to introduce you to infection prevention and control as a scientific discipline, why it's significant in terms of epidemics and pandemics, and then sort of recognize the minimal requirements for IPC that are required during this pandemic. So I won't spend too much time on module 1, but just very quickly, the one thing I always like to emphasize in my trainings is that infection prevention and control is completely based in science. So the information that we talk about in terms of practices, hand hygiene, sharp safety, decontamination, all of those practices are really evidence-based. So that means there is a lot of research and a lot of literature that really well notates that these are effective and efficient practices to be able to minimize the actual transmission of disease to patients and healthcare workers. So when we're talking about IPC, it's almost like a guarantee that if we implement these practices correctly and efficiently, that we will drastically reduce the amount of infection. And right now, the one that we're most concerned with is COVID, but most infections that we can spread within a healthcare context are drastically reduced when we adhere to these principles. The one thing that I always like to emphasize is that IPC is definitely not something that you just do during a pandemic. It's really an activity that has to be continuous, because the best way to control epidemics and pandemics is to actually have robust systems already in place long before we have acute emergencies. So really, IPC is an ongoing activity that we want to make sure that we utilize to the best of our abilities to make sure that all of us within a healthcare facility and within the communities that we live are taken care of appropriately. So when implemented and performed correctly, as I had mentioned, we can reduce the transmission of COVID-19 in healthcare facilities and communities. We can ensure that healthcare workers, patients networks, and communities are safer, and enhance the ability of the actual organization or healthcare facility that's responding to the outbreak do so more efficiently. Now, I'm not going to read these next 3 slides, but I wanted you to have this information available to you. It has come to my attention over the years that within our region, all of our different member states have different levels of IPC programs and guidelines established. And so on the next 3 slides, these are the minimum IPC requirements for COVID-19 that your nation and member state should have at each level of the healthcare system. So step 1 really talks about making sure that you have thorough assessments and baseline information that can be utilized to inform the activities that you want to implement. Step 2 talks a lot about the implementation of activities that we would want to implement at the different levels of the healthcare system. And then step 3 looks at how do you maintain and sort of monitor and evaluate the actual activities that you have implemented to ensure that we're actually bringing down those COVID-19 cases, as well as ensuring a safe continuity of services at the same time. One of the things I always like to emphasize when I do a training is that as awful as epidemics and pandemics are, the vast majority of our patient populations are unfortunately going to be at great risk of having morbidities and mortalities that are associated with non-epidemic or non-pandemic related health causes. So for example, I worked 2 years as a clinician and an IPC specialist in Sierra Leone during the 2014 EVD epidemic, and there were more people that died of HIV and tuberculosis and cancer and other non-EVD diseases during that epidemic than they ever died of Ebola. So what does that mean? Not only do we have to make sure that we're taking care of patients in our communities that are immediately affected by the epidemic or the pandemic, there are many, many more patients that are going to need to utilize continuity of services during this emergency. And the patient population we are going to want to really focus on today are our pregnant persons in our communities to ensure that they are able to get safe and dignified care. So that's really it for that first module. Again, it's a very, very high overview of infection prevention and control. I wanted to spend the majority of our time today on module 2 and 3, really getting into more of the details in terms of the context of maternity and OB-GYN considerations. But before I move on to the next module, I always like to ask, are there any questions before I proceed? Are there any questions?
No questions in the Q&A as yet.
Okay, just want to make sure and give everyone time to go forward. Okay, so let's jump right in. So as you can see, I get very excited about this topic. This is my life's passion. I spent many years as a clinician working in low resource contexts, and I've spent many years working with infection prevention and control because really IPC is the basics. It is the foundation of every healthcare service delivery that we can provide as clinicians to our patients. So in this module, we are going to talk about how you can define and identify standard precautions and their relevance in maternity care settings, specifically antenatal settings. We're going to describe the importance of conducting a risk assessment when you're dealing with maternity care settings. We're also going to define and identify administrative and environmental precautions within maternity care. And then we want to be able to recognize how to establish a triage station and the IPC requirements for triage in a health facility. So module 2, we're going to focus more in module 2 on antenatal and outpatient department maternity settings. So Standard precautions. I won't spend a lot of time here, but standard precautions are the basics of IPC precautions. These are the precautions that we use for all patients at all times, irrespective of their disease status, irrespective if they're a suspected or a confirmed COVID patient. These are the minimum prevention measures that we are going to apply to all patients, regardless of why they are presenting to our healthcare facility. There are 8 of them. These are the 8 standard precautions. I'm going to focus a little bit more today on hand hygiene, PPE, safe injection practices, environmental, and then medical device decontamination and disinfection. So just to let you know, today in terms of maternity care, I've selected the 5 standard precautions that are really the most critical for that patient population. So I'm going to take a deeper dive.